This month is Movember, the time of year when men grow out their mustaches to raise awareness for men's health issues.
That's right, and here to give us more insight on the importance of this global event is our 9 health expert, Dr. Pyle Coley. Dr. Coley, good morning.
Good morning. I'd love to see a mustache on you.
Yeah, well, I'd like to see one too. I don't know if I'm capable of growing it, to be honest. Talk a little bit more about the importance of Movember, especially in respect to cancer in men.
You know, I'm so glad that we're doing this because the American Cancer Society actually predicts that cancer deaths are going to go up 93% in men over the next 20 years or so, and cancer cases are going to double. So the idea of getting our men to focus obviously on their cancer prevention, which we know men are terrible at doing screenings and getting prevention, also thinking about their mental health, thinking about suicide prevention, that's the idea of this month. And so much of what we do can influence these outcomes, our lifestyle choices, how much alcohol we drink, whether we smoke, whether we exercise enough, whether we sleep. This is all in our control.
Jordan's pretty good about this, I will say, but for the most part, my husband included, why are men so reluctant to go to the doctor and get checked out?
I mean, it's kind of crazy. The surveys tell us over 50% of men admit that they don't regularly go for any kind of screenings or even problems when they have issues. And I think a lot of it is cultural and psychological. So there's this kind of societal expectation that men are expected to be tough. So a lot of men feel like complaining, especially about mental health, but even about physical health, may be perceived as a sign of weakness, a lack of masculinity. I also think that society doesn't set men up in the same way to get preventive care as it does for women. So we're really good about reminding women about pap smears and, mammograms and such. But when it comes to PSA testing or thinking about colonoscopies, we're just not as good.
A big cancer that, of course, is a fear of a lot of men is testicular cancer, which Movember focuses on. When we talk about breast cancer, we talk about, at-home tests that people can do. What about with testicular cancer? Are there things that we could do before we even go to the doctor?
Yeah, so testicular cancer is a rare cancer, thankfully, but highly, highly treatable. So really important to catch early. And the reason we want to put this on everybody's radar is because it actually peaks early in life, between 15 and 35, when most men are not thinking about cancer. And then there's a second peak around the age of 60. But the way that most men pick it up is actually testicular self-exam or a mass. And so the American Cancer Society recommends once a month after a warm shower that you actually check your testes every month and you look for lumps or bumps or irregularities, difference in shape or size or tenderness. And that's a really important thing for men to start to do, especially Movember might be a great time to get started.
Yeah.
I can't believe 15. That is so young. I don't think that people are thinking about that, at such a young age. And I love that there's kind of this fun wraparound with Movember with the beards and stuff, but how can we all really get involved in Movember and really make sure that men are taking care of themselves?
So I think for every man in your life, remind him about Movember, because if you know 100 men in the U.S., 42 of them will get cancer. So almost half the men in your life will end up getting cancer. So just remind them about those preventive screenings. Yeah. And it's not just about cancer, it's about heart disease prevention. So know your numbers, know your risk, tell them to go get their numbers checked at this time. Certainly growing a mustache is a great way to remind the men in your life to do that, but just little things, encouraging them to move more, encouraging them to focus on self-care, and really all of us working together to remove that stigma that so many men in our lives have, that they can't ask for help or they can't reach out if they're struggling with mental health issues.
Dr. Coley, thank you. We appreciate your input on this important topic. And by the way, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.